Swastiastu. Hello, doctors and friends. So we're from SGD 6 and we're going to present our student project called Intestinal Perforation. So first, here are our group members. And we're going to start from the chapter 1, Introduction. So my name is Geraldine Rachel with the last 2 digits student ID is 100, and I'm going to present first about the background information. So intestinal perforation is condition when there is a discontinuity or a hole in the bowel wall. It commonly occurs as a complication of prior inflammation or trauma along the intestine. The occurrence of perforated bowel may show various clinical presentations depending on the location, cause, and severity of the condition or perforation. The incidence and mortality rates of bowel perforation also vary depending on the underlying cause and population being studied. And surgical intervention is required to repair the perforation, remove any damage or necrotic tissue, and prevent further complication. So that's all from me. Thank you.
So my name is Catherine Angela and my student ID number is 21025 1116. So the questions answered in this literature review are: what is the definition, clinical manifestations, etiology and pathophysiology, epidemiology, evaluations needed, differential diagnosis, treatments and management, as well as the prognosis of intestinal perforation. And the purpose of this paper is as stated here. Meanwhile, the benefits of this student project are to improve students' knowledge and comprehension regarding intestinal perforations and to serve as a reference for future intestinal perforation-related research.
Hello, my name is Gusti Agung Saraswati. My last digit number 056. Now I will explain about definition intestinal perforation. Intestinal perforation is a loss of continuity of the intestinal wall or a gap, a hole in the intestine, often also called a hole in the intestinal wall, which can cause intestinal contents to come out into the stomach, can cause peritonitis. This occurs due to complications caused by various disease process, including instrumental, inflammation, trauma, malignancy, obstruction, infection, and ischemia. Management and treatment may be important to prevent to potentially lethal peritonitis, prevent morbidity and systemic sequelae from celiac of intestinal contents. That's all for me. Thank you.
Thank you for the opportunity. My name is Rosie Villani with the last 3 digits of student number being 168. So the epidemiology of intestinal perforation can be classified by age. First, in preterm newborns, it is usually caused by necrotizing enterocolitis. In children, it is by abdominal trauma and appendicitis, but it is infrequent as the incidence is only 1 to 7%. In adults, intestinal perforation usually caused by acute abdominal perforation. Moreover, duodenal ulcer perforation occurs 2 to 3 times more frequently than gastric ulcer perforations. 10 to 15% of patients with acute diverticulitis develop pre-perforation. The mortality for adults is 20% to 40%. In geriatric patients, perforated appendicitis is the most common cause, with the morbidity and fatality rates both being 35%. That's all from me. The presentation will be continued by my friend.
Thank you for the opportunity. My name is Gede Ariana Saputra with the last 3 digit number of name 018, and I would like to discuss with you guys about the etiology of intestinal perforation. So intestinal perforation can lead by 4 mechanisms. The first one is ischemia, infection, erosion, and physical disruption. The necrotic nature of ischemia leads to the death of intestinal wall cells causing perforations, where ischemia may happen by 2 means. The first one is bowel obstruction and thrombotic or embolic disease. Severe and chronic case of infection usually leads to perforation, where feces will turn into an anatomical dead end which cause internal pressure, infection, and abscess. Perforation can also result from erosive disease like adenocarcinomas or ulcerative disease like Helicobacter pylori cause peptic ulcers, while external disruption can also cause perforation physically.
My name is Nureni Desari with your last digit of name 084. Intestinal perforation results from a destruction of intestinal tract that causes spilling of the air and digestive content into the peritoneal cavity. There are 4 mechanisms that causes intestinal perforation, including ischemia, infection, erosion, and physical disruption. Elderly people are more likely to experience intestinal perforation due to ischemia, and particularly if they have a history of heavy smoking, coronary artery disease, or clotting disorder. And most common infectious causes of intestinal perforation are appendicitis and diverticulitis. Partial erosion can progress to full thickness tears over time, or a particular injury can trigger a spontaneous rupture. Penetrating or blunt abdominal trauma or iatrogenic injury via instrument, such endoscopy, can all result in mechanical injury to the wall of a hollow viscous.
My name is Tiffany Cecilia. Now I will explain about the clinical manifestation. Almost all patients experience abdominal pain, usually accompanied by nausea, vomiting, weak bowel function, or fever. Details of symptoms such as duration, previous episodes, recent procedures such as endoscopy or colonoscopy, and aggravating and mitigating factors are important in determining the cause of perforation. A family history of cancer and a personal history of colonoscopies may be important in determining the possibility of occult cancer or inflammatory bowel disease. Vital signs should be assessed promptly during the initial evaluation. This may be indicate signs of serious or septic shock and may justify an urgent need for resuscitation and treatment. During the physical examination, it is important to visually inspect the abdomen for surgical scars, visible hernia or injuries, and bloating.
Hello, my name is Jan Clarin Samarga with last three digits of student number 134. Today I will explain about the diagnosis of intestinal perforation. In physical examination, there are several signs and symptoms that can be found, like if patient lie immobile, knees flex, and abdomen board-like, it can suggest there is peptic ulcer disease. If there is tachycardia, fever, generalized abdominal tenderness, and absence of bowel sound, there are maybe peritonitis. Abdominal fullness and dumpy consistency can suggest intra-abdominal hemorrhage. And in imaging tests, CT of the abdomen and pelvis is the most sensitive and specific test. But abdominal and chest X-ray can be useful too. That's all from me. Thank you.
My name is Made Ayurane Parawita. My last three-digit student ID number is 226. Differential diagnosis of intestinal perforation can be reduced in order that intervention can concentrate around the intestinal regions where the perforation is most likely to occur. A peptic ulcer illness with acute onset which leads to severe epigastric or back pain is included in the differential diagnosis list for upper gastrointestinal perforation. Another differential diagnosis that can appear is intestinal obstruction characterized by the sudden onset of periumbilical pain, nausea, vomiting, and impaired bowel function. Colon perforation should be taken into consideration where there is a previous history of left lower quadrant pain as well as a reduction in stool quantity. Along with all of the previously listed conditions, there are a number of other differential diagnoses for intestinal perforations, which include acute pancreatitis, endometriosis, appendicitis acute, gastritis, typhoid fever, colitis, Crohn's disease, ischemic colitis, and inflammatory bowel disease.
Now we will move to the treatment. First of all, my name is Jeremy Nathaniel Yohaja with the three digits of my student's number 26. The course of treatment for intestinal perforation depends on the degree of injury and the underlying cause. Initially, conservative management is conducted to stabilize the patient's health, including IV fluids, bowel rest, and antibiotics. IV fluid is essential to maintain the balance of fluids and electrolytes to prevent hypothalamic shock. Bowel rest is also crucial to give the intestines time to recover, and a nasogastric tube is inserted into the stomach to drain its content. Broad-spectrum antibiotics are also necessary to prevent and treat infections that may occur. When conservative management is insufficient, operative management such as laparotomy or laparoscopy can be conducted. Laparotomy involves cutting the abdominal wall to access the abdominal cavity and determine the extent of injury, whereas the laparoscopy is minimally invasive surgical treatment that involves making a small abdominal incision and inserting a laparoscope to access the belly. Studies have shown that both are effective in managing intestinal perforations, and the choice of surgery depends on the severity of the disease.
My name is Putra Adisti Cecilia Sujana with the last digit name is 241. I will be continuing the explanation about prognosis. The prognosis of intestinal perforation depends on several factors, including the cause, location, and size of the perforation, followed by patient's overall health, the time between the onset of symptoms and treatment. In general, prompt and appropriate treatment can lead to a good prognosis, like doing surgery, for example. But in some cases, there are patients who are unable to tolerate or choose not to undergo surgery when it is required. This may cause a worse prognosis. Delayed treatment or severe complication can also lead to a poorer prognosis, especially in older patients which have higher chance to have worse complication. That is all from me. Thank you.
My name is Anjani Prambadani with last three digits 148. So I will explain about the conclusion. First is intestinal perforation is a condition where a hole forms in the intestinal wall as a complication of previous inflammation or trauma along the intestine. This occurs due to complication caused by various disease process. The causes of intestinal perforation are grouped according to age and geography. Most patients with intestinal perforation will experience abdominal pain accompanied by nausea, vomiting, fever, or decrease of bowel function, and the diagnosis of this condition can be confirmed by physical examination and imaging tests. And treatment of intestinal perforation is carried out based on the degree of injury. Thank
Now
you.
let me introduce myself. My name is Safira Agustin with the last three digits 150. Now we come to the suggestion. The writers hopes that the readers will find this article useful. We know that this paper is far from being ideal. As a result, constructive criticisms and suggestions will be extremely beneficial in improving this writing. We also recommend conducting additional research information regarding intestinal perforation. That is all from us. Small group discussion B6. Thank you for watching.